Imagine this. You're gently petting your beloved rabbit, feeling their soft fur, and then your fingers brush against a lump. An unexpected, maybe hard, pea-sized lump. For any pet owner, that's a moment that can make your heart sink. It instantly triggers a cascade of questions. Welcome to the deep dive. Today, we're tackling a surprisingly complex and actually really crucial topic for rabbit owners: abscesses in domestic rabbits. We've gathered a stack of detailed sources, everything from experienced breeders sharing tips on YouTube, right through to in-depth scientific reviews from veterinary journals. Our mission for you, our listener, is to really unpack this. We want to extract the essential knowledge to help you feel informed, maybe more confident in managing this common health issue. We'll look at what these sources say about rabbit abscesses, how they're different from those in other animals, how to spot them, and crucially, how best to treat and prevent them. Okay, let's dig in. When we think of an infection like a normal abscess, we might picture something runny, easy to drain.
Yeah, something you might see in a cat or dog, perhaps.
Yeah, exactly. But rabbit abscesses are, well, a whole different ballgame, aren't they?
That's absolutely right. It's fascinating, actually, how distinct they are. Unlike in many other species, rabbit pus is incredibly thick, dense, almost like a dried toothpaste.
Dried toothpaste? Wow.
Yeah, and it's not just a random thing. It's because they're neutrophils. Those are a type of white blood cell that fights infection. They have very low levels of the enzymes that normally break down dead tissue into liquid. So the result is this thick, caseous, that means cheese-like material. It doesn't drain easily, and it often gets walled off by this really thick fibrous capsule.
So it's not just a simple pocket of infection. It sounds more like a fortified bacterial fortress, really hard to get into.
That's a great way to put it. They're localized infections, showing up as these firm lumps. And while the abscess itself isn't contagious, person to person or rabbit to rabbit, the underlying bacteria can spread. That thick pus and that dense capsule are huge challenges. They're poorly vascularized, meaning not much blood flow gets in there.
Which makes it hard for antibiotics to work.
Exactly. It's incredibly difficult for antibiotics to penetrate that wall and reach the bacteria effectively. And if they're left untreated, they can eventually burst. That creates an open wound, prone to more infection, and the pus spreading inside can cause, well, much bigger problems.
That sounds really serious. Where do these typically show up on a rabbit? Are there common spots?
Yeah, there are. You often find them around the head, the shoulders, sometimes the feet, or along the jawline. For male rabbits, the bucks, those scent glands under the chin are a pretty common sight.
Okay, and what are the first signs? Just a lump?
Initially, it might just be a small bump, but as it progresses, the skin over it might get red, maybe feel a bit warm. And building on that, while some abscesses might just come from a simple cut or scrape, a really significant number, especially ones around the head and jaw, are directly linked to dental disease.
Okay, here's where it gets really interesting and so unique to rabbits. Can you explain what elident dentition means and why it's so critical here?
Absolutely. Rabbits have elidont dentition. Basically, it means their teeth grow continuously throughout their entire lives.
Continuously, like forever.
Pretty much. We're talking maybe 1.4 to 3.2 millimeters per week for their teeth. It's amazing. But this constant growth absolutely requires constant wear. They need to be grinding down their teeth, mainly with a high-fiber, abrasive diet. Think lots and lots of hay.
Right.
So if their diet doesn't have enough abrasive stuff, maybe too many pellets, not enough hay, their teeth can overgrow. This leads to malocclusion, where the teeth don't line up properly, they don't grind down evenly, and you can get sharp points, or even just abnormal pressure that allows infection to set in.
So diet is huge,
Yeah.
but it's not the only way bacteria can sneak in, right?
What about injuries?
Oh, definitely not the only way. Trauma or injury is another very common cause. It could be anything from scratches, bites, especially if rabbits fight, or even just rubbing against rough cage surfaces, fractured teeth, splinters from chewing on wood, even tiny foreign bodies like sharp pieces of hay, or one source actually described a case caused by a sewing pin.
A sewing pin? Seriously?
Seriously. Anything that breaks the skin is an entry point for bacteria, like Pasteurella, which is a really common culprit in these abscesses.
Wow. Okay, so injuries, bacteria. What about deeper issues? You mentioned dental disease being key for head and jaw abscesses.
Yes, exactly. Often those are linked to problems beneath the surface. There's something called apical elongation.
Apical elongation.
Yeah, it's when the roots of those continuously growing teeth actually extend too far into the bone. This puts really painful pressure on the surrounding nerves and structures. It can even block tear ducts, which is why you sometimes see eye discharge with dental problems.
Ah, okay, that makes sense.
Another really significant factor is metabolic bone disease, or MBD. Rabbits have this unique way of handling calcium. They absorb almost all the calcium they eat and then pee out the excess.
That sounds efficient.
It supports their tooth growth, but it also makes them really vulnerable if their diet is imbalanced. If they don't get enough calcium or vitamin D, their bone density suffers. The bone supporting the teeth, the alveolar bone, gets weaker, and that dramatically increases the risk of abscesses forming around the tooth roots.
So it's not just about wearing the teeth down, it's about the nutrients building strong bones to support those teeth. That's a key connection.
Precisely. And vets can often spot early warning signs like periodontitis inflammation or widening around the tooth socket on x-rays or CT scans. That's often an early stage of what's called the progressive syndrome of acquired dental disease, or PSADD, which can definitely lead to abscesses down the line.
Got it.
And we also have to be aware of iatrogenic causes, things caused by treatment itself,
Like what?
like improper clipping of teeth or issues after incisor removal. If those aren't done perfectly, they can unfortunately create conditions where infection can start. So with all these potential causes, it really brings up a critical point. How early can owners spot these issues, and what should they actually do?
Yeah, that's the big question, isn't it? Beyond just feeling a lump, what are those crucial clinical signs owners should be looking for, and when is it definitely time to call the vet?
Well, besides the obvious lump, behavioral changes are key. Anorexia, or reduced appetite, is a big one. Or maybe they seem interested in food but have trouble chewing. You might notice excessive salivation, drooling, which can make the fur around their chin wet, and listen for involuntary teeth grinding. It's called bruxism. It often sounds like a soft clicking or chattering, and it's usually a sign they're in significant pain.
And I've heard rabbits are just masters at hiding pain, so those subtle signs are incredibly important to catch.
They really are.
Yeah.
You have to be observant. Other signs include weight loss, maybe dehydration, their coat condition might look poor, or they stop eating their cicatropes, those special nutritional droppings.
Okay.
Interestingly, unlike in many other animals, a fever pyrexia is not typically seen with these dental-related abscesses in rabbits.
Oh, that's good to know. Not what you'd expect.
No. But if you see discharge from the eye, or dacryocystitis that's an inflamed tear duct, sometimes with swelling right near the eye, that can definitely point towards an underlying dental abscess pushing upwards.
Okay, so an owner finds a lump or sees some of these signs. What's the immediate action plan?
The number one message, really, from all the sources is never ever ignore a lump. Even a tiny one warrants attention.
Right.
Owners should get into the habit of regularly checking those key areas: head, shoulders, feet, along the jaw, under the chin, especially in bucks. Just gently feel for anything hard, pea-sized, or bigger. And as we said, watch that behavior closely. Because they hide pain so well, any change, eating less, drinking less, being more lethargic, hiding more, these are all critical warning signs. Get them checked out.
And when is it definitely time to pick up the phone and call the vet? Is there any situation where at-home care is okay?
Okay, immediate vet call if the lump is growing quickly, if the rabbit stops eating or drinking entirely, if there's any discharge or obvious swelling, or if they seem clearly in pain or very lethargic. Don't wait. Now, about home care. Some very experienced owners, people who've dealt with this before, might consider some very limited initial steps for a tiny early abscess, but only under strict guidance from their vet.
So extreme caution needed.
Extreme caution. The overwhelming advice, and honestly the safest approach, is to consult a rabbit-savvy vet. One source put it very bluntly, saying lancing an abscess sucks, it can smell, and it's gross.
Huh. Okay, point taken.
It really underscores why it's best left to a professional. The risk of making it worse, causing more pain, spreading infection, or not draining it properly is just too high for most people to attempt safely at home. And given how complex these can be, often hiding deep infections, diagnosis really requires more than just looking at the lump.
Okay, so what tools do vets use then? How do they figure out exactly what's going on under the surface, especially if so much can be hidden?
Well, it always starts with a really thorough physical exam. That means not just poking the lump, but looking from a distance, checking size, any crusts, any draining tracts or fistulas. Then careful palpation, feeling for facial symmetry, any other swellings, checking the bone for irregularities, especially around the jaw. And an oral examination is absolutely critical, looking carefully at the teeth, the gums, the tongue for any signs of malocclusion or infection. This often requires sedation or even full anesthesia to get a proper detailed look inside the mouth.
Right, because they won't just open up and say, ah.
Exactly.
Yeah.
And then when we need to see deeper, beyond what fingers or eyes can tell, that's where imaging becomes essential. It sounds like it's absolutely crucial for these rabbit abscesses.
So x-rays, CT scans.
Yes, both are really important. Plain x-rays or radiography are often the first step. They're valuable, but because rabbit skulls have a lot of overlapping structures, you really need multiple views, side, angle, top, down, to interpret them properly.
Yeah.
Abscesses might show up as sort of darker radiolucent areas, maybe with signs of reactive bone around them. But for a truly comprehensive picture, multi-detector computed tomography (CT) is often considered the gold standard
Why CT?
because it completely eliminates that problem of overlapping structures. It gives these incredibly detailed cross-sectional images, even 3D reconstructions. It lets the vet see the tooth roots, the tissue right around the roots, the nasal passages, the soft tissues, everything. It really reveals the full, often hidden extent of the abscess in a way that a visual exam or even x-rays just can't.
That makes sense. Getting the full picture is key. What about figuring out which bacteria are causing the trouble? That seems vital for treatment.
Absolutely critical. That's where microbiological culture comes in. You need to know what you're fighting. Rabbit abscesses are very often polymicrobial, meaning multiple types of bacteria are involved, both aerobic, needing oxygen, and anaerobic, not needing oxygen.
So taking a sample is important.
Yes, and how you take it matters. It's best to get samples not just from the pus in the middle, but also from the abscess wall, the capsule, because that's often where the live bacteria are hiding. You need special anaerobic transport media, cap the syringe immediately, and specifically ask the lab to culture for both aerobic and anaerobic bacteria. Anaerobes often get missed otherwise,
Why is that specific culture so important?
because it guides the specific antibiotic choice. Just guessing, using empirical therapy without knowing the bacteria and what they're sensitive to, can be completely ineffective, or worse, it could contribute to antibiotic resistance, or even harm the rabbit if you use the wrong drug.
Okay, so diagnosis is key. Now, with that diagnosis, what does treatment actually look like? The sources seem clear. Antibiotics alone usually aren't going to cut it.
Right, and that really brings us back to that fundamental challenge. Why are antibiotics alone often just not enough in rabbits? It's that thick caseous pus we talked about, isn't it?
Yeah, that fortress wall. And that really highlights why these are so uniquely difficult. What is it about that thick pus in the rabbit system that makes treatment so tricky?
Well, precisely that. The thick, dense pus, plus that fibrous capsule wall, severely limits how well antibiotics can even get to the bacteria. It's a physical barrier.
Okay.
On top of that, rabbits have incredibly sensitive digestive systems. Certain oral antibiotics, especially things like penicillins, macrolides, lincosamides, can wipe out their normal gut bacteria and lead to fatal enterotoxemia. So the choice of safe antibiotics is already limited.
Wow. Right.
Then you add in challenges like bacterial biofilms, which can form in chronic infections and make bacteria even harder to kill, plus the growing problem of multi-drug resistant MDR strains. It becomes a very complex situation.
So given all those hurdles, what are the actual treatment options? Sounds like you need multi-pronged attack.
You absolutely do. Surgery is really the cornerstone of treating these effectively. The ideal goal is complete surgical removal and block excision of the entire abscess capsule. If it's dental-related, you also need to extract the diseased tooth or teeth involved. And the surgeon needs to be aggressive in cleaning out any infected bone, called debridement or curettage.
What if they can't remove it all? If it's too deep or stuck to vital structures?
That happens. If complete removal isn't possible, the vet will aim to create a permanent drainage route. This could be marsupialization, essentially sewing the abscess lining open to the outside or packing the wound. This allows for regular flushing and applying topical medications directly into the cavity. Post-op care is also vital good pain control, usually with drugs like meloxicam or buprenorphine, and crucial nutritional support, often with high-fiber critical care formulas to help them recover.
Okay, so surgery is key, but antibiotics do still play a role, just not usually on their own.
Yes, systemic antimicrobial therapy is almost always needed alongside surgery. But again, the choices are restricted because of the gut sensitivity. Drugs like fluorocanolones and rofloxacin is a common one, and potentiated sulfonamides are often the preferred choices because they tend to be safer for the rabbit gut. But ideally, the choice should always be based on those culture and sensitivity results we talked about. Guessing is risky, especially with rising antimicrobial resistance, or AMR.
Right.
And sometimes, vets might recommend probiotics, like Enterococcus faecium, to help support the gut bacteria during long courses of antibiotics.
Okay. What about treatments that go right to the abscess site to try and bypass some of those systemic issues or penetration problems?
Yeah, local antimicrobial therapies are definitely gaining ground for exactly that reason.
Hmm.
They can deliver high drug concentrations right where needed with fewer systemic side effects. Manuka honey is one interesting option. It can be applied topically, especially if there's soft tissue involved.
Done.
Yes, medical-grade Manuka honey. It's hygroscopic, meaning it draws moisture out of the wound. It acidifies the wound environment, which bacteria don't like. It has anti-inflammatory and direct antimicrobial properties. And some studies suggest it even helps with bone regeneration. Plus, it's non-toxic if the rabbit happens to ingest a bit.
That's fascinating. And there's an even more targeted approach, something about antibiotic beads.
Yes, antibiotic-impregnated polymethyl methacrylate beads, or AIPMAMA beads. These are quite clever. Basically, the surgeon mixes a powdered, heat-stable antibiotic into bone cement, forms small beads, and implants these directly into the abscess cavity after cleaning it out.
And they release the drug over time.
Exactly. They provide a sustained, high local concentration of the antibiotic for maybe 2 to 4 weeks, which
Right.
is especially useful for deep infections or bone infections, osteomyelitis. But the vet has to choose the antibiotic carefully. It needs to be heat-stable to survive being mixed in the cement. Things like gentamicin or cefazolin often work, but drugs like enrofloxacin or penicillin won't. And there are downsides. The beads are rigid, they don't dissolve, so they might need removing later, and once they're in, you're committed to that antibiotic choice unless you do another surgery. So it's a powerful tool, but needs careful consideration. And thinking about how severe these infections can be and the intensive treatments required, that really leads to the critical question: what happens if these abscesses aren't treated? And maybe more importantly, what can owners actually do to prevent them in the first place?
Yes, the impact can be just devastating. So prevention really does feel like the absolute key here. Can you walk us through some of the serious complications that can happen if these abscesses aren't dealt with?
Oh, the consequences can be incredibly severe, unfortunately. If you have an infection starting the upper cheek teeth, for instance, it can extend right up into the eye socket. This causes what's called a retrobulbar abscess. It can lead to exophthalmia, where the eye actually bulges out, terrible inflammation, vision loss, and in the worst cases, the eye might even need to be removed, enucleated.
Oh, wow. That's awful.
It is. And even before that, you can get infected material filling the spaces around the eye socket, sort of paving the way for that retrobulbar abscess. Osteomyelitis infection spreading into the bone itself is another very common and serious complication. Abscesses also have a nasty habit of recurring if they aren't completely removed surgically. And sometimes complications can even arise from treatment itself, like accidental jaw fractures during surgery or chronic draining tracts. It can be a really difficult path for the rabbit.
This sounds like a really long and potentially painful journey. So what's the outlook, the prognosis generally like for rabbits facing these?
It really varies hugely. It depends a lot on where the abscess is and what caused it. Abscess on the front part of the lower jaw, the side of the cheek, near the front of the eye, those generally have a better, more favorable prognosis because they're easier for the surgeon to access and treat thoroughly. But if the abscess is way back on the lower jaw or involves the nasal cavity or sinuses, the prognosis becomes much more guarded. The anatomy is complex back there, and the infection can invade extensively. The cause matters too. Abscesses linked to congenital teeth problems often have a poor outlook. Those caused by trauma might be more favorable if caught early. And if metabolic bone disease is the underlying issue, the prognosis is often poorer because the whole skeleton can be affected.
But veterinary medicine is improving, right? Is there more hope now than there used to be?
Definitely. Advances in diagnostic imaging, like CT scans and refined surgical techniques, have significantly improved outcomes for many rabbits. We can understand the problem better and treat it more effectively now. That said, euthanasia sadly remains a necessary consideration in severe chronic cases where there's persistent pain, ongoing weight loss, or the rabbit just isn't responding to treatment. Quality of life has to be the priority.
Which brings us back firmly to prevention being the best medicine. What are the absolute must-do things for owners to keep their rabbits healthy and hopefully avoid this whole ordeal?
Number one, without a doubt, is dietary management. It is the cornerstone. A high-fiber diet based primarily on grass, hay, timothy, meadow, orchard grass is absolutely essential for proper, continuous tooth wear. That's non-negotiable.
So lots and lots of hay.
Loads of hay. You need to limit the amount of pellets they get and strictly avoid those muesli-type mixes with colorful bits. Rabbits often pick out the tasty, unhealthy parts and leave the fiber, which leads straight to dental problems.
Right.
And ensuring they get adequate, but not excessive, calcium and vitamin D is also crucial for that bone health we discussed. Remember, they absorb almost all calcium, so balance is key. Don't overdo supplements unless your vet advises it.
Okay, diet is number one. What else can owners do in the rabbit's environment and daily routine?
Environmental enrichment plays a big role too. Provide plenty of fibrous things to chew on, safe, untreated wood branches like willow or apple, cardboard tunnels, grassy mats. This encourages natural chewing behavior, which helps wear down teeth, and it keeps them mentally stimulated.
Makes sense.
Keep your living area clean, dry, and free of any sharp edges or hazards that could cause injuries. And if you have multiple rabbits, take steps to prevent fights, especially between unneutered males or young littermates before weaning. Bites and scratches are common ways for bacteria to get in.
And general hygiene.
Absolutely. Regular cleaning and disinfection of water bottles or bowls, food dishes, litter boxes, and flooring is important. Always wash your hands thoroughly after handling a rabbit, especially if they have any wounds, and dispose of soiled bedding or dressings properly.
What about the role of the vet in prevention?
Regular veterinary checkups are crucial. Ideally every 6 to 12 months for a thorough physical exam, including a conscious look inside the mouth. For rabbits considered high risk for dental issues, the vet might recommend stomatoscopy using a small endoscope to get a magnified view inside the mouth, maybe even under light sedation to catch problems really early. And honestly, owner education is massive. Understanding proper nutrition, recognizing early signs of trouble, and crucially, knowing not to attempt things like trimming overgrown teeth with nail clippers at home.
Oh, people do that.
Unfortunately, yes. It can cause fractures and lead to abscesses.
Mm.
Dental procedures should only ever be done by trained veterinary professionals to prevent causing more harm. And, if we step back and connect all this to the bigger picture, rabbit abscesses aren't just about the individual rabbit's health. They actually touch upon this broader concept called One Health.
One Health. What do you mean by that? How does a rabbit abscess connect to anything bigger?
Well, the One Health concept recognizes that the health of animals, humans, and the environment are all interconnected. So, for example, while the abscess itself isn't usually contagious between species, some of the bacteria found in rabbit abscesses, things like Pasteurella multicida, Staphylococcus aureus, sometimes E. coli or Pseudomonas, can potentially be opportunistic pathogens for humans.
Really?
The risk is generally low for healthy adults, but people who are immunocompromised, young children, or even owners doing wound care at home need to be aware and practice good hygiene hand washing, maybe gloves, to minimize any potential risk.
Okay, so there's a potential, if small, direct link there, but the implications go further, don't they? You mentioned antibiotic resistance earlier.
Absolutely. This is a huge One Health issue. We're frequently finding multi-drug resistant, or MDR, bacteria in rabbit abscesses. Strains resistant to multiple antibiotics, including some like certain fluoroquinolones or aminoglycosides, that are critically important for treating serious infections in human medicine.
Wow.
When these resistant bacteria develop in animals, potentially due to inappropriate or overuse of antibiotics, it contributes to the larger pool of resistance genes in the environment, which can eventually impact human health too. It really underscores why using antibiotics judiciously, meaning only when necessary, and always based on culture and sensitivity testing if possible, is so incredibly important, not just for the rabbit's outcome, but for protecting the effectiveness of these vital medicines for everyone. It makes treating a rabbit abscess part of a much larger, interconnected global health challenge.
We've really journeyed through the unique and often difficult world of rabbit abscesses today. From understanding that thick, stubborn pus and the fortress-like capsule to the critical central role of dental health and diet, the challenges of treatment requiring surgery and careful antibiotic use, and ultimately the absolute importance of prevention. I think the key takeaway here is pretty clear. Rabbit abscesses are serious. They're often rooted in those unique dental issues, and they absolutely demand a proactive, informed approach from owners. While some limited home care might be discussed with a vet in rare, specific situations by very experienced hands, the risks are high. Early veterinary intervention, using advanced diagnostics like CT scans, and following a tailored, often multimodal treatment plan offers the best chance for a good outcome. So here's a final thought for you to ponder as we wrap up. The health of our rabbits, these seemingly small pets, is intricately linked not just to the hay they eat or the cleanliness of their cage, but to much broader ecological and medical concerns, like the global crisis of antibiotic resistance. Think about it. Next time you find a lump or even just choose their food, consider that intricate web of health. It stretches from a tiny potential abrasion on your bunny, connects to their unique physiology, leads to complex veterinary decisions, and ultimately touches on global challenges that affect us all. What might seem like a localized issue with your rabbit could actually be a microcosm of a much larger interconnected story, something to think about.